All right, welcome back in. We are going to be going through a few pieces here that are related to anatomical terminology. So far, my lectures have talked about sections 1.1 through 1.5, and today I'm going to be talking about medical terminology or anatomical terminology. So we're going to just run through this chapter together, and at the same time, I'm going to show you what's in our visible body courseware application, which has our lab assignments in it. And they correlate, of course. So I want to show you a little bit about that. So here we go. First of all, to walk down here into anatomical terminology. One of the very first things to learn in human anatomy and physiology is that we always think of all of our terminology as related to what is referred to as anatomical position. This is best seen as a human being standing upright and facing you as such. So if the person is standing upright with palms facing forward, so that as you're looking at their face, you'd also be able to see their palms. With basically feet shoulder width apart and the arms dangling all the way down till they're straight with palms facing forward, that's referred to as anatomical position. And then that gives us the ability to name surfaces of the body relative to that position. What I would like you to do with this is sort of go up and down this particular image here and look at some of the names, anatomically correct names of these areas. For example, we might refer to the armpit, but the proper anatomical term is axilla or axillary. So if you're taking someone's axillary temperature, for example, you would take it under their armpit. We always use the term chin, but that's mentis. Another interesting thing, you might think of the leg as being everything from here down to here. But in truth, in anatomical terminology, the leg is only from the knee down to the ankle. So this is the leg, or the crus is the proper anatomical term. From the knee up to the pelvis would be the femur, which is actually the bone in there, but it's actually the leg itself at this point. That commonly used term leg at this point is referred to as the femur, both front and back. You can see here it's called the femur as well. Just notice some of these issues. The popliteus is the area behind the knee. The front of the knee is called the patella. You can kind of look up and down this terminology and put some of this to memory. All right, this is definitely worth your while to go through these points. Okay, so let's go take a look at some of what we refer to as regional terms. Okay, you have to get used to describing the body in terms of directions, and so we're going to use some terminology bolded here, and these are the ones I definitely want you to get to know. Anterior, posterior, superior, inferior, lateral, medial, proximal, distal, superficial, and deep. These are put together in pairs. So if you look at anterior and posterior, this is essentially the front of the body. For example, this is the anterior of the body. This is the posterior of the body. The next two were superior and inferior. And so if you were looking from the top down, so this way down, this is superior view if you were happen to look down on the head. And if you were looking up from the feet up this way, that would be an inferior view. Okay, so they're paired together. Now I want you to notice that these terms also have synonyms. So anterior, for example, is the same as ventral. Posterior, the same as dorsal. Now, usually the way this works is like this. If the patient is standing up like this, we would consider this the anterior side. If the patient instead was laying down, then the stomach side would be referred to as the ventral side. But they're the same and they're interchangeable. You can use them any way you want, but that's a common way of using those terms. Same thing here. Superior, looking down, can be considered cranial. Think of this as the cranium, right? That's the skull. So cranial view. And then caudal is basically the tail. Now humans don't have a tail, but if they did, it would be coming out about right here. And so as we take a view that's inferior, we're actually taking a caudal view. So if you were to, for example, to be looking at a person laying down on his stomach and tracing something along the spine, If you were tracing towards the head, you would say, I'm tracing superior, or I'm tracing cranial. If you're tracing towards the feet, you'd say, I'm tracing inferior, or I'm tracing caudally. Okay, so just some ways to pair those terms and understand that those things go together. All right, lateral and medial go together, proximal and distal go together, superficial and deep go together. Let me quickly talk about lateral and medial. The body has a center line. I'm not sure if that is in here. It's not, so I'm going to just talk about it up here. The body has a center line. So if you were to look at the human body and imagine a perfectly drawn line right down the center of this person, right down through the center of the person, you would have two equal sides, a left and a right side. That line that runs right down through the middle is the medial line of the body. And then anything that goes off to either the right side or to the left side would be considered lateral. So here is the lateral surface. Here is the medial plane, the lateral surface over here. So left and right lateral surfaces, and essentially anything that you move. So you could say, well, I'm starting at the median line and moving laterally towards the shoulder or the axilla in this case. Or I could be here and say I'm moving laterally towards the body wall. So anything out here is lateral, anything here is medial, and you just kind of use that as a relative term. And then superficial and deep literally just means, is it at the surface of the body, or are you describing something that's farther from the surface, interior? So the brain, for example, is living inside of the skull, of course. The brain then is going to be your deep structure, and the skull is your superficial structure. Okay, so here are some of those same terms that I just used. Here's medial, you see here in the middle. Here's lateral as we move out to the side. Here is posterior and anterior, front and back, or ventral and dorsal. And here is cranial and caudal, as we talked about earlier. This would be superior and inferior. Okay. One last thing. I want to talk about the pair proximal and distal. And so proximal and distal basically refers to two ends of the same structure. And the way you can tell which side is proximal and which side is distal is to ask which side is closest to the midline of the body, or the medial line of the body. So, for example, in the femur, which is a bone that begins here and ends here at the patella, the distal end is the part near the knee. The proximal end of the femur is the part that's nearest to the pelvis. And the reason is that the pelvis is closer to the midline than the part closest to the knee. So you could say this. You could say the ankle is distal to the knee. The knee is distal to the pelvis, and so on. In the arm, the fingers are distal to the shoulder. The elbow is distal to the shoulder. The elbow is proximal to the wrist or to the fingers. So proximal closest to the midline, distal farther away. So again, start to get used to these terms. These are really important terms for us to be using as we go through the class. Okay. Couple quick things to add to this are the sagittal, are the body planes. And so a lot of times what we're doing with the body is we're dissecting it in a way that we can see the interior structures. And so there's a couple of ways of doing that. You can cut the body in halves that create a front and back. So for example, if you see this plane going across here, it's an imaginary plane cutting right down through this woman's body, creating a back and a front to it. That's called the frontal plane, also sometimes known as the coronal plane. It creates a back and a front as you cut right down along the axis of the body. Now, if you flip that plane around, you come all the way around to this one. This is called the sagittal plane, and the sagittal plane cuts the bodies into right and left halves. You can have a mid-sagittal plane, which cuts the body into equal left and right halves, or you can have sagittal planes that are not quite right down the middle. And so you can also use these transverse and sagittal cuts, these frontal and sagittal cuts on any particular item. So if you had the forearm, let's say for example, and you wanted to make a frontal plane, you could cut it in such a way that you have the back of the arm and the front of the arm, or you could use a sagittal plane where you cut it right down the middle and you have right and left halves. These are not going to be perfect because the arm itself is not symmetrical. Or you can have a transverse plane. Notice the transverse plane cuts across the long axis of the body here, separating it into caudal down this way, and cranial halves, or superior and inferior halves. And you can take that transverse plane and cut it anywhere. You can cut it here across the body, or here, wherever. Often called a transection or a transverse plane. Okay. One last piece to add to this are the body cavities. In broad terms, there are two broad body cavities. There's a dorsal cavity and a ventral cavity. The dorsal cavity consists of two subcavities. One that holds the brain, called the cranial cavity, and the other that holds the spinal cord, called the vertebral cavity. And so they're continuous with one another. It's just one big continuous cavity. Obviously, the brain and spinal cord are continuous with one another. But that's the dorsal cavity. Now, these structures, the brain and the spinal cord, have membranes on them, and that membranes carry a double membrane. It carries a fluid called cerebrospinal fluid that actually surrounds the entire brain, the entire vertebral column, kind of cushioning it. And that's a theme you're going to see. Inside of body cavities, there typically are these membranes that hold a fluid and protect the body organs. Okay, so that's the dorsal body cavity here. The ventral body cavity includes these pieces right here, which really there are only two broad categories. The ventral body cavity has two basic subcavities within it. There's a thoracic cavity and an abdominopelvic cavity, which is the combination of these two here, the abdominopelvic cavity. Here you see it over here, abdominopelvic cavity. If we look carefully at these cavities, the thoracic cavity has basically two pieces to it. It's going to look like three, but it's really just two. There's a mediastinum, which is all of this right here in orange and blue or teal. And it's subdivided into two things: a superior mediastinum up here, and then down here is the cavity that holds the heart, called the pericardial cavity. Anyway, this is all part of the mediastinum. We'll come back and talk about this pericardial cavity in a minute. And then it also has what's in purple here, the the pleural cavity, which holds the lungs. So right and left pleural cavities holding the lungs. Now, like the dorsal cavity has membranes surrounding in a fluid, so do these cavities have membranes surrounding in a fluid. And I'll come back and talk about that in a minute. Just want to go down here to the abdominopelvic cavity and recognize it is consisting of two parts: an abdominal cavity and a pelvic cavity. All right, so if we were now to think about those membranes that surround the cavities, there are three primary ones we're going to concern ourselves with. There's a pleural membrane that surrounds the lungs. There's a pericardial membrane that surrounds the heart, and there is a peritoneal membrane which surrounds the abdominal cavity, or peritoneum, it's referred to. Let's go take a close look at what those actually look like. Here is a good example of them. If you imagine a balloon and a fist pushing into it, imagine the fist is the heart. This is kind of what this membrane looks like. There's an interior membrane covering the heart itself here. That's usually called, or it is always called, the visceral part of the membrane, this double membrane. And then it also is connected to an outer part that runs up against the wall of that cavity. Anything that's surrounding the heart, creating that little cavity for the heart to live in. This part of it is known as the parietal part of the membrane. So there's a visceral part lying on the organ, a parietal part lying on the surrounding the cavity, and then there's a fluid in between there called a serous fluid, and that is what actually cushions the organ. And of course the heart is constantly beating, and so it needs a lot of cushioning for the things that are living around it, like the lungs and other organs that are living around it. So this provides the heart a nice frictionless environment to work in, and it protects it. And then again, in this case, it's called the pericardial sac, or the pericardial membrane. And there's a visceral pericardium running right along the heart, like I talked about, and a parietal pericardium running right along the surface of the cavity that it lives in. Inside of that is the pericardial cavity filled with that fluid I was talking about. And so that's the way these cavities are lined. Same goes for the pleural cavity. So the lungs have exactly the same thing. They will have a visceral pleura right up against the lung itself, and a parietal pleura lying up against the cavity the lungs are living in, and with a fluid inside of it, just exactly the same way. And then the abdominal cavity has the peritoneum, again with a visceral peritoneum lying up against the organs, and a parietal peritoneum lying up against the body wall, fluid in between. So important to recognize that all of those organs are surrounded by these membranes and protected in a fluid-filled kind of way. One last quick thing in your chapter here, and then I'll close out this video and open up another one to show you the visible body. The abdominal cavity has regions and quadrants named, and I wanted to go through this with you really quickly. One simple way to do it is just to use the body symmetrically on the anterior surface. Make a plane right down from the sternum here, right down to the pelvis, to the middle of the pelvis, and then right across, right at the top of the hips here. And if you do that, you've separated the abdominal cavity into 4 quadrants. You have a right upper quadrant, a right lower quadrant, a left upper, and a left lower. Remember, this patient is laying on his or her back. So that's one simple way to lay out these quadrants. But if you break it up a little differently, you can break it up into 9 quadrants. This isn't used quite as often, but if you know exactly what organ you're talking about, maybe a surgeon is talking about removing a gallbladder or a spleen or a particular kidney or something like that, then these come into better use. If you orient yourself, this is actually not too difficult. Look in the middle here. Pretty simple. If you know where your belly button is, that's the umbilical region. The belly button, of course, is where the umbilical cord once was connected. So the umbilical region's right in the middle. If you go up from there, you get epigastric. The term epi, it means on top of. So on top of the gastric region, stomach region. So epigastric, and then hypogastric. So you'd think this would be called the gastric region. That'd be nice, but it's not. Umbilical region, then epigastric, and then hypogastric. If you look to the sides, let's go to the right side. You have a right hypochondriac region, and that region is the part that's just below hypochondriac. Chondria are the ribs. So just below the ribs, right chondriac, and then look, left hypochondriac. So pretty easy there. If you go into the lower back area, you have a right lumbar region and a left lumbar region. This just means back. Lumbar means back. So hypochondriac, below that is the back or the lumbar region, and then go down a little bit further and you get into the iliac region. That's part of the pelvis. So the right iliac region and the left iliac region. So not too bad. Go down the middle, you've got umbilical, epigastric, hypogastric. On the left side, you got left hypochondriac under the ribs, left lumbar in the back area, left iliac near the hip. Same thing on the right-hand side. Pretty easy. Okay, I'll close out this video because it's getting long, and then I'm going to open up another video here to show you what the lab assignment for this particular week looks like, and it corresponds nicely to this.